The history of St. Joseph Eye Hospital, Mgbirichi. The construction of the hospital started on the 14th February 2007. It was officially opened on the 29th of December 2009 with free eye treatment, whereby more than 350 patients were beneficiaries. The hospital is owned and managed by the Congregation of the Daughters of Mary, Mother of Mercy, in collaboration with NGO, the Christian Blind Mission, CBM. It is located at Mgbirichi in Ohaji-Egbema local government area of Imo State. Mgbirichi is about 18 kilometers from the capital city of Imo State, Owerri. It is accessed through the Owerri-Port Harcourt Express Road. Owerri is easily accessed through neighboring cities, Umuahia, Okigwe, Aba, Onitsha, Yenegua, and Port Harcourt. Mission statement of the hospital is to witness to our patients the humble service of Christ by providing excellent and merciful care. The vision statement is to eliminate avoidable blindness through the provision of equitable access to quality, comprehensive, affordable, and inclusive eye health services. In terms of infrastructure, we started with OPD block, ward with 32 beds, theater block, kitchen block, generator house, 1 ophthalmologist, 1 optometrist, 2 ophthalmic nurses, 2 community health workers, 1 optician, 1 bursar, 1 driver, 3 janitors, 1 storekeeper, 1 maintenance technician, and 2 security. Presently, we have lots of buildings, 66 beds, 70 staff, 2 consultant ophthalmologists in residence, 1 visiting pediatric consultant ophthalmologist, 1 visiting anesthetic consultant. Our future services will include corneal surgery such as transplant, corneal refractive surgery, retinal surgery, rehabilitation center for our low vision patients, research institute, training, Infeco training, small incision cataract surgery training, glaucoma surgery such as trabeculotomy and glaucoma drainage tube surgery, primary eye care, theater assistant training, biomedical training. Having had our services and future plans, I invite you to come and access our facility. Seeing is believing.
What we do in St. Joseph Eye Hospital, basically, our medical and surgical treatments aim to maximize vision. Medically, we treat and manage all kinds of eye diseases that cut across all age groups through our professionals, some are visiting consultants in various subspecialties. In surgical, we do cataract surgery using various techniques: phacoemulsification cataract surgery, small incision cataract surgery using different lens materials from foldable, hydrophobic, hydrophilic acrylic lenses, yellow-tinted intraocular lenses that absorb blue light and protect the retina from damage, and then the very affordable PMMA lenses. Glaucoma surgeries such as trabeculectomy and drainage tube device. In pediatric cases, we do pediatric cataract surgery and pediatric glaucoma surgery. So conjunctival surgery like pterygium incision with autograft. Various forms of eye repairs such as corneal repairs, scleral repairs, lid repairs, globe repairs. Oculoplastic surgeries like lid surgeries such as chelation, entropium, ectropium, and ptosis, etc. The bulking surgeries like enucleation and evisceration. Probing and syringing of lacrimal drainage system. We also have the facility of 24/7 emergency surgeries of trauma cases. Laser procedures for glaucoma, we do selective laser trabeculoplasty, peripheral laser iridotomy. And for post-cataract surgery, we do ND-YAG capsulotomy. We also give intravitreal injections of anti-VEGF for various kinds of retina and macular treatment. We offer eye health enlightenment programs as well. Enlightenment programs to churches, organizations, and tertiary institutions. vision screening program to primary and secondary schools. St. Joseph Eye Hospital has a large heart in terms of community outreach programs, where we reach out to people in their homes around and beyond the states through provision of free eye medical and surgical services. We have a club called St. Joseph Glaucoma Club, where subsidized treatments are given to our glaucoma patients.
The optometrists are primary health care specialists trained to examine the eye to detect defects in vision, signs of injury, ocular diseases, or abnormality and problems associated with the eye through general health, such as diabetes or high blood pressure. We also provide comprehensive eye and vision care, which includes refraction and dispensing, and the rehabilitation of conditions of the visual system. Optometrists work in good synergy with opticians in making sure corrective glasses are being dispensed properly. The optical unit is a pivot in which the optometrist operates maximally. We dispensed the following: minus lenses, plus lenses, spherical lenses, photochromic anti-reflective lenses, blue cut lenses, contact lenses for high powers, prosthetic contact lenses, and contact bandage lenses. We also have low vision clinic where we dispensed both optical and non-optical aids, optical aids, telescopes, and magnifiers. For non-optical aids, text reading software, check guides, large print publications, talking watches and clocks. Investigations, we do the following: the basic test, visual acuity test, intraocular pressure test, high blood pressure test, blood sugar test. For glaucoma workup, we do anterior and posterior OCT, perimetry, pachymetry, and gonoscopy. For cataract workup, we do ocular ultrasound A and B scan, biometry. For retina workup, we do fundus camera or retina camera, posterior OCT tests, ocular ultrasound B scan tests, color tests, and arms grid tests. Our support services. GMM St. Joseph Eye Hospital is in collaboration with Christian Blind Mission International, Vision for the Poor USA, Ezebilio Foundation, and Divine Okwara Charity Foundation. The aim is to eliminate the avoidable blindness in Nigeria. For this, the organization is typically outreach-driven and primarily targets disadvantaged population, particularly persons with disability and school children in underserved rural communities. From its inception till date, GMM St. Joseph Eye Hospital have provided to patients free eye health education and raised awareness on the best practices in eye care, supported free eye medical services to tens of thousands of patients in rural and urban areas, specifically in communities, churches, and schools across states in eastern Nigeria. Via our programs, the organization have provided thousands of free eye surgeries and supported thousands of patients with drugs and glasses, specifically the disadvantaged population. Through our collaboration with international and local organizations, GMM St. Joseph Eye Hospital over the years have implemented and is still implementing projects to improve comprehensive and inclusive eye care services, and also providing quality service delivery to beneficiaries to date. At St. Joseph Eye Hospital, we adhere strictly to international best practices in safeguarding, ensuring that no harm, no abuse, and no neglect comes to anyone in contact with our facilities and program. We are enthusiastically open and call for more partnership in contributing to eliminating avoidable blindness in Nigeria. You can be part of it.
The objectives of St. Joseph Eye Hospital are: 1. To improve the quality of life of persons with visual impairments and other disabilities through provision of comprehensive, inclusive, accessible, and affordable eye care services that are integrated into the health systems of Nigeria. 2. To contribute to the elimination of harmful traditional practices responsible for increasing the spread of eye diseases that leads to blindness. 3. To establish networks and linkages within and outside Imo communities to enhance the response of the communities to the visually impaired. 4. To conduct eye surgery. And 5. To conduct community outreaches. We have our annex hospital, Daughters of Mary, Mother of Mercy Vision Center at Aheke, Omahia, Abia State, for easy access to eye health services to people living in that location.